Bismillahirrahmanirrahim. In this lecture, I will discuss about the ECG leads and ECG electrodes, and I will try my best to clear your concept regarding these ECG leads and ECG electrodes. Although it appears tricky, but it is not. Once you will go through it. Now, you all know that there are 12 ECG leads 1, 2, and 3 AVR, AVL, AVF, V1, V2, V3, V4, V5, and V6. 1, 2, and 3 they are called the bipolar limb leads. AVR, AVL, AVF they are called the augmented limb leads. And V1 to V6 they are called unipolar chest leads. Now, next is that through which lead which part of the heart can be shown in a better way. That is lead 1 and in lead 1 and AVL we see the lateral side of the heart, while in lead 2, 3 and AVF we see the inferior side of the heart. Any MI in inferior aspect of the inferior side of the heart we can better see in lead 2, 3 and AVF, while in V1 and V2 we see the septum of the heart. So any infarct, any ischemia in the septum of the heart we can best see in V1 and V2, while V3 and V4 in these two leads we see the anterior aspect of anterior side of the heart, and V5 and V6 we again see the lateral side of the heart. So you can say for lateral side of the heart, lead 1 AVL and V5 and V6, these four leads are being used, and there's a mnemonic that is LISAL, that is L for lateral, I inferior, S septum, A anterior, L lateral. I 1 and AVL lateral, 2, 3 AVF inferior, V1, V2 septum, V3, V4 anterior, and V5, V6 lateral side of the heart. Now next, where we discuss about the electrodes. There are 10 electrodes. 4 are applied on the limbs and 6 are applied on the chest wall. Now, you are seeing the color coding system like the traffic signal, red, yellow, and green. Now, red electrode is applied on right arm, and yellow electrode it is applied on left arm, and green electrode it is applied on left leg, while the black electrode it is an earthing electrode and it is applied on the right leg. Okay, and these 4 electrodes are applied on the 4 limbs. Now next turn is about the chest electrodes. The chest electrodes they are again 6 in number, and to place the chest electrodes we have first to locate the sternal angle. Once we locate the sternal angle on the chest wall, you know that the second rib is attached to the sternal angle, and below the second rib there is a second intercostal space. We start counting downward, and third intercostal space, and then in the fourth intercostal space. So V1 is applied in the fourth intercostal space close to the sternum on the right side of the sternum, whereas V2 is applied in the same manner, like this, a fourth intercostal space but close to the left side of the sternum. V3 is applied between V2 and V4. Now, where is the V4 is applied? V4 is applied in left fifth intercostal space in the mid-clavicular line, and V3 is applied between the application of V2 and V4. Now, V5 is applied in the left fifth intercostal space in the anterior axillary line, while V6 is applied in left fifth intercostal space again, but in the mid axillary line. In this way, we have applied our 4 limb electrodes and 6 chest electrodes. Now, to record the leads. For leads, you always require one positive electrode and one negative electrode. So for lead 1, for lead 1, on right arm you will apply the negative electrode, and on left arm there would be the positive electrode. So in the downward you can see a vector drawn from the right arm to the left arm, because charge flow from the negative side to the positive side. And to record the lead 2, again the negative electrode is applied on the right arm, whereas the positive electrode in this way, in this lead, we will apply on the left leg. So the vector would be drawn from right arm to the left leg, that is from the right side towards the downward and towards left side. And for lead 3, the negative electrode is applied on left arm, whereas the positive electrode is applied on the left leg. So the vector direction would be from the left arm towards the left leg, that is downward and slightly towards the right side. So in this way we have applied these electrodes, and in this way we can record our the leads. You can be asked that for lead 1 where would be you apply the negative electrode and where you will apply the positive electrode. So you should know that for lead 1 the negative is right arm, positive is left arm, and so on. You can understand from this that for these leads, right arm would always act as a negative electrode, whereas left leg would always act as a positive electrode. Whereas the left arm, it could be either positive or it could be either negative, depending on for which lead it is being used. Next is for AVR, AVL and AVF, these 3 leads, these augmented limb leads. For AVR, the positive electrode is applied on the right arm, on the right wrist, while for AVL, the positive electrode is applied on the left arm, and for the AVF, F stands for foot, and we only use the left leg. So for AVF, the positive electrode is applied on the left leg, on the left medial malleolus. Okay, positive electrode. So as I discussed previously, that for every lead there would be one positive electrode and one negative electrode. In lead 1, 2 and 3, I discussed that I tell you about the negative electrodes, but in AVR, AVL and AVF, I didn't tell you about the negative electrode. So where would it be? For AVR, AVL and AVF, the negative electrode is a virtual electrode which is located in the center of the chest, and it is also called a zero electrode or null electrode or reference electrode or Wilson central terminal electrode. Anyway, and you can say any, you can remember it from any name. Later on I will discuss you that how this virtual electrode or a reference electrode is made. Before that, I tell you about the V1 to V6 leads. For V1 to V6 leads, there would be one exploratory or a positive electrode, and the second would be a reference electrode. Again, like for V1, V2, V3, V4, V5 and V6, the positive electrode is that one which we have applied on a particular location. Like for V1, it is in the 4th intercostal space close to right side of the sternum. V2, 4th intercostal space close to left side of the sternum. These are 6 electrodes. These are the positive electrodes. These are the exploratory electrodes. So again, for these positive electrodes, there would must be a negative electrode, but I have not tell you about where we will apply that negative electrode, and that negative electrode is again that virtual electrode, that central terminal electrode, that zero electrode. Now we must clear our concept about the central terminal electrode. Then central terminal electrode, here I have drawn it, that there's a simple physics rule that if on a triangle equal current or equal voltage or equal electrical activity is present on the corner of a triangle, then if we sum up that either that is positive or negative, if we sum up that electrical activity or a voltage, then in the center of that triangle, that electrical current would be equal to 0. okay, that electrical current would be equal to 0. So in this way you can say that ECG machine is simple a galvanometer, functions on the principle of a galvanometer. There would be a one positive electrode and one negative electrode. For the creation of the reference electrode or central terminal electrode, we connect three wires with this negative terminal, and these three wires, one is connected to the right arm, second is connected to the left arm, and third is connected to the left leg. Now I have applied these three wires. Now heart, you can say that heart is in the center of this triangle, and whatever would be the electrical activity in the heart, it would be equally transmitted towards the right shoulder or left shoulder, or at the junction of the left leg and trunk. Equal electrical activity would be sent. Then, as I have told you earlier, that if there is an equal electrical activity at the corners of the triangle, when we will summate it, then it would be equal to 0 in the center of the triangle. So that in this way a virtual electrode is created in the center of this triangle, which would be 0 electrode, or we can also say it reference electrode or virtual electrode, because exactly not a negative electrode is being applied in the center of the chest, but it is created in a virtual manner. So hope so you have understand about the central terminal electrode. And next I tell you about the angles of these leads. You can see here how I draw the lead 1, lead 2 and lead 3. You will take the lead 1 as a reference lead, so it would be at a 0 degree, and lead 2, how much it forms an angle with the lead 1, almost 60 degree, whereas lead 3 it almost makes an angle of 120 degree. Here you can again see in red lead 1 0 degree, lead 2 60 degree, and lead 3 120 degree. I have drawn in a dotted line, and you can see that lead 3 with reference to the lead 1, it is almost about the 120 degree. Whereas the AVR, AVL and AVF, their electrical axis almost makes an angle of 120 degree with each. Okay, these leads AVR, AVL and AVF, these all three leads, their electrical axis make an angle of 120 degree with each other. So again, if we lead 1 is take a lead where the lead 1 is located, if we take it as a 0 degree, so above the 0 degree there would be a negative value, and so AVL almost makes an angle of minus 30. And if we start and go down from lead 1 as a reference, so AVF would almost makes an angle of 90 degree, and lead AVR, it almost makes an angle of 210 degree. This was all about the ECG leads and ECG electrodes. Hope so you have understand it and there is no confusion regarding it. If you have any confusion, you can ask in comments. So but we all discuss about these leads and electrodes, that there are 12 leads but there are 10 electrodes, and we also discussed that through which leads which part of the heart can be best visualized, and for that there was a mnemonic, that is Lisa. Hope so you have understand it, you have enjoyed it, and thanks for watching.